Hi, doctor.
Hi.
When a person should see a doctor for a rectal pain or bleeding?
Well, the fact is, as soon as you have rectal bleeding or pain, you should see a doctor. In fact, you should see a surgeon right away.
Is all rectal bleeding is cancers?
Absolutely no. It is most of the times it is a very, very minor problem, which pretty often can be treated with very minor medicines or local applications or change in dietary habit, which should take care of rectal bleeding or pain. The common cause of pain in the back passage is actually a crack in the back passage, which is in medical parlance called a fissure, which is not a very uncommon thing amongst young men and women. Having passed a hard bolus of stool, there is a crack in the back passage, and the change in dietary habit, local ointment application as prescribed by the surgeon, most of the times take care of that. Rectal bleeding can also happen with fissure, but the more common cause of rectal bleeding is actually hemorrhoids, which again can be and most commonly treated in a very conservative manner, where the change in dietary habit, not straining too much during defecation, and local ointment applications and some medicines pretty often takes care of these sort of problems.
Thank you, sir. There must be many patients who comes to you complaining that they are having pain while passing stools. Why such pain occurs to them?
As I said to you, pain during defecation most commonly is due to a crack in the back passage. Sometimes it also happens if there is small mass of hemorrhoids which get prolapsed and get thrombosed or get infected. So that would depend on the clinical examination, and depending on what the findings are, the surgeon would advise the correct treatment.
Next, doctor, what are the common causes of rectal itching?
Rectal itching is mostly due to poor hygiene, not other than, sometimes it's also for worms, but generally in adults it is mostly due to poor hygiene, where there is a lot of moisture in the perineal area in the gluteal folds, and sometimes it's because of moisture that there is a bit of fungal infection, and in the background there can be diabetes, which can lead to perineal itching. So itching is actually not within the surgeon's domain. If there is perineal itching, one should actually see a dermatologist.
Lastly, sir, all rectal problems actually need surgery?
Certainly not. Most of the rectal problems do not need surgery. Most of the rectal problems can be treated with very, very minor medications, local ointments, and change in dietary habit, advice, and most of them don't require. However, if, as I said to you, if a person has repeated fissures and pain which is coming back repeatedly, then there is a question of advising surgery. If it is really painful and the patient is having this problem of fissure repeatedly, then yes, surgery. If somebody has hemorrhoids where there is a lot of loss of blood leading to drop in hemoglobin, then and requiring transfusion, then well, surgery is considered. If there is hemorrhoids which has complications like prolapse and thrombosed hemorrhoids, then also there is a question of recommending surgery. However, there is also a warning that hemorrhoids can come back even after surgery, so it is best avoided.
Thank you so much for your insight, sir.
Thank you.